My name is Taylor Ahalt, and I will be speaking to you about Hashimoto's thyroiditis, which is a disease that I was actually diagnosed with in 2013. Hashimoto's thyroiditis is an autoimmune disease also known as chronic lymphocytic thyroiditis and chronic autoimmune thyroiditis that was discovered by Hikaru Hashimoto in 1912. Autoimmune diseases are simply diseases in which the immune system mistakenly attacks healthy cells in your body. In this particular autoimmune disease, the body makes antibodies that attack the cells in your thyroid. As shown on screen, the thyroid is a butterfly-shaped gland located in the front of the neck just below the Adam's apple. Hashimoto's is the most common cause of hypothyroidism in the United States in individuals older than 6 years old. Hypothyroidism is the term for an underactive thyroid, which means that the thyroid gland can't make enough of the thyroid hormone to keep the body running normally. Hashimoto's is a very poorly understood disease, but it is thought to arise from an interaction between genetic susceptibility factors, epigenetic effects, and various environmental triggers such as infection, dietary factors such as iodine, stress, and pregnancy. A study done by Ruggeri et al. Indicated that the disease is actually associated with different non-thyroidal autoimmune diseases at different ages. Some of these include pernicious anemia, adrenal insufficiency, celiac disease, and type 1 diabetes mellitus. Another study done by Mazokopakis et al. Indicated that an association may exist between vitamin D deficiency and the development of Hashimoto's. Despite these studies and all the other research done on this disease, there are no definite answers regarding the etiology of Hashimoto's. Women are about 7 times more likely to have this disease than men, and sometimes it even begins during pregnancy, making being a woman a risk factor. Most cases of Hashimoto's happen between 40 to 60 years of age, making being middle-aged a risk factor as well, although it can appear in younger ages such as it did in myself. This disease also tends to run in families, making heredity a risk factor. A study done by Bothra et al. Reported that, compared with the general population, first-degree relatives of persons with Hashimoto's thyroiditis actually have a 9-fold greater risk of developing the disease. Having other autoimmune diseases also increases a person's risk of developing Hashimoto's. Interestingly enough, my mom was recently diagnosed with hypothyroidism and pernicious anemia, which is another autoimmune disease. This really goes to show that thyroid disorders and autoimmune disorders really can be hereditary. Since Hashimoto's is not as widely recognized as a health condition as something such as cancer or diabetes, information regarding incidence and prevalence for this disease was harder to find. I was unable to find state and local breakdowns of this information, but was able to find some regarding occurrence in the United States. The incidence in the U.S. is estimated to be 1.3% in a series of 5,000 children aged 11 to 18 years, while it is estimated to be 3.5 per 1,000 per year in women and only 0.8 per 1,000 per year in men. The incidence is estimated to be about 10 to 15 times higher in females. In regards to the prevalence of this disease, in general, it increases with age. The Colorado Thyroid Disease Prevalence Study, which involved 25,862 adults, discovered the prevalence of elevated TSH in symptomatic and asymptomatic adults to be 9.5%, with a greater percentage of those involved being women. As previously mentioned, this disease occurs most commonly in middle-aged women between the ages of 40 and 60 years old. It has also been found to be more common in regions of high iodine dietary intake. According to a study that analyzed the medical records of all U.S. active duty military personnel ages 20 to 54 from 1997 through 2011, Caucasians have an increased risk of Hashimoto's thyroiditis when compared to other ethnic groups. While Hashimoto's itself is not fatal, if left untreated and in severe cases, it can lead to life-threatening complications or be a risk factor for developing other potentially fatal diseases. Mixed edema coma is a very rare complication of untreated Hashimoto's, which results in a loss of brain function and can be fatal in severe cases. This is 3 to 10 times more common in women and occurs more commonly in the elderly who have had an undetected and untreated hypothyroidism disease for many years. There is also a well-established relationship between Hashimoto's and thyroid lymphoma, and the risk of papillary thyroid carcinoma is also increased. In some cases, Hashimoto's disease causes cardiac conditions which rarely can lead to death. Thyroid hormone replacement is the main treatment for this disease. The most common drug that is prescribed is titrated levothyroxine sodium, which is taken orally and is what I take daily and will have to take for the rest of my life. I have to get my TSH, or thyroid stimulating hormone levels, tested every 6 months to make sure that they are within the normal range, and occasionally my levels will rise for whatever reason and I will have to have my medication dosage increased. Epidemiologic research and studies have led us to learn many new things about this disease within the last several decades. It has led us to discover things such as the fact that iodine nutrition is a key determinant of thyroid disease, and that thyroid dysfunction and autoimmunity are associated with an adverse effect on fertility. It has been found that high TSH levels are associated with diminished ovarian reserve in women of reproductive age. Being a woman of reproductive age with Hashimoto's myself, the studies done on this topic are of particular interest to me as I want to be able to have children in the future. A cross-sectional study was done at the Endocrinology Clinic for Thyroid and Autoimmune Diseases with 66 women aged 18 to 60 years who had Hashimoto's to evaluate the prevalence of infertility in women with the disease and associated risk factors. The women were interviewed to obtain data on their gynecological and obstetric history and family history of autoimmune diseases. Their medical records were also examined so that researchers could determine the characteristics of the disease and to confirm association with other autoimmune diseases. With infertility being defined as 12 months of unprotected sexual intercourse without conception, the prevalence of infertility in this study was 47%. While this study did not include a very large number of women with Hashimoto's, a 47% prevalence of infertility in this small number of women is telling. The association between Hashimoto's and infertility has led to tests on the effectiveness of hormone replacement therapy on regulating the hormonal mechanisms of reproduction. Studies done on this have shown better chances of conceiving once on levothyroxine. It has also been determined that once a woman with Hashimoto's is able to get pregnant, the dosage of her levothyroxine needs to be increased by about 30%. The implications of the knowledge we have received about Hashimoto's, fertility, and pregnancy due to epidemiology are great and have led to several changes. Pregnant women and women who are having trouble getting pregnant are now being screened for thyroid diseases more often than before, and women with thyroid disorders are getting the proper treatment while pregnant that we now know is needed. Hopefully, some of the more recent advances in technology will provide us with a better understanding of the relationship between genetic factors and therapeutic factors in Hashimoto's, and we will find new ways of managing this disease in the future. Hi,